係對於應用呢啲 RAT 咧有咗一個嘅修訂嘅睇法。咁啊，希望能夠真係做到或者提升我哋早發現感染者嘅能力。咁啊，早發現嘅好處咧，就係感染嘅人士自己會知道自己已經感染咗啦，咁佢一定會採取一啲個人嘅保護或者係自我隔離咧嚟到保護佢嘅屋企人。亦都係會唔出街啦，因為可以保護到個社區啦。咁亦都幫助到衛生當局咧，可以更加早介入，去提供一個早隔離同埋早治療。咁啊 ，RAT 近日喺市場咧，亦都係供應好充足，價錢亦都係大幅回落。我記得舊年呢個時候，我哋自己去買咧都要成百幾蚊一個嘅。咁啊，而家一啲亦都係同樣係可以接受嘅 RAT 嘅測試包咧，即係10幾蚊啊，都可以買到。而特區政府過去呢2-3個月喺中央嘅全力支援之下咧，亦都係購入咗大量嘅 RAT， 亦都用唔同途徑咧係派發俾香港市民，直接同埋間接由我哋嘅庫存嘅RAT 派出去咧，已經係接近800萬㗎啦。一半咧係由民政事務總署按住每日嘅污水檢測，向嗰啲污水檢測濃度比較高嘅地區嘅居民啦，佢嘅保安員啦，同埋係清潔嘅工友啦派發。另外亦都係透過一啲地區嘅社團組織嚟到去派發嘅。咁有咗呢個可以幫助早發現感染者嘅重要工具咧，衞生防護中心就係採取咗以下幾項措施。第一咧就喺2月25日就宣布咧，特區政府係會直接咁去接受呢個 RAT 嘅陽性嘅結果咧，
accept RAT positive result as a confirmed case. There is no need to take another sample for PCR verification. And then the second measure was also announced on the same day. The CHP will set up and launch an online system as a notification system, declaration system for individuals tested positive for COVID-19 using RAT for people to report directly. It was launched formally on the 7th of March. Of course, on the day of its launch, people just tested positive could report the results. So the 6th and the 7th, they could report immediately. It also offered an opportunity for cases tested positive through RAT before the launch of the scheme that covered the period between the 26th of February and the 3rd of March, because, as I said, we announced on the 25th of February that would accept an RAT positive result as a confirmed case. So for members of the public who tested positive during the 26th of February to the 5th of March, they could declare through the system. The deadline for retrospective reporting was the 14th of March, to allow the health authorities to have a better grasp of the epidemic. And then those infected during the period might have already recovered. They might have no symptoms or very mild symptoms or with mild discomfort. After the period, they would be no longer sick, and if the symptoms were serious, they would have been hospitalized. But we would like to confirm the status of a confirmed case. That is to confirm that a person was infected with COVID-19.
We have not announced cases reported during this period, since it would not be meaningful to issue an update every day. As of Monday, we have compiled the number of reports so far, and those who made reports would indicate when they tested positive. And as such, we could compile the overall figures. Between February the 26th to March the 5th, for those who declared positive RT results, the number was 184,390. And this is the distribution of the dates of declaration. The green bars denote those who tested positive through PCR tests, and the orange bars denote those who tested positive through RAT.
咁你會見到咧，就係佢冇乜改變到香港個大體嘅疫情嘅情況下，
see that the overall trend for COVID-19 in Hong Kong remained largely unchanged.
到目前為止，檢測結果呈陽性嘅高峰係
From the chart, we saw that the pandemic peaked on March the 3rd. So that was the case whether or not we include the RT positive cases. And we have seen a downward trend in the number of cases. In the last few days, starting March the 11th, we saw a plateau in the number of cases, and we did not see a declining trend. That is why now is a critical
好啦，我哋其實真係喺呢個工作裏邊咧，都係科學為本嘅。我哋除咗係睇每一日嘅確診數字，即係話嗰個感染已經發生咗啦。咁我哋睇啲呈陽性啊、確診嘅數字，可以知道個現狀。
From the number of positive cases, we can identify the current situation, but we want to be forward-looking as well. And that is why we engage in different areas of work in the meantime. And one example is sewage testing. Sewage testing started in October 2020, and since then we have constantly carried out sewage testing, and our work never stopped, even when we saw no new local cases. The work is conducted jointly between the EPD, Drainage Services Department, and a cross-disciplinary team at the University of Hong Kong. I visited the HKU laboratories twice to find out about their work. Since the fifth wave of the pandemic started, sewage testing has been reinforced. We introduced many extra fixed sewage testing spots. And that is why that means we would take samples at these spots on a regular basis. And we also introduce new ad hoc testing sites. If we saw high viral levels at fixed testing points, we would try to identify the buildings that give rise to these high viral levels. And if we look at the average figures, we saw a declining trend. The trend peaked earlier on February the 28th.
即係嗰個確診或者嗰個陽性個案出現之前啊嘛，咁所以大概係有4日嘅差別嘅。
There is a 4-day difference between the trends of sewage testing and the number of positive cases. That means we can identify the trend a few days earlier. In the last few days, we have experienced a plateau denoted by the red circle. That is why we must not let our guards down during this time. This chart denotes the number of cases detected through restriction testing declarations under CAP 599J. The Secretary for Food and Health would issue RTDs at restricted areas, and all individuals within the restricted areas are subject to mandatory PCR tests. We have carried out many such operations since the fifth wave started. Since January, 226 RTD operations were completed, and 154 were completed after February the 1st. And the number of preliminary positive cases detected through each operation was substantial, and in recent operations we have managed to identify 800 to 900 or more than 1,000 cases after each operation. So the numbers have remained high in recent days. The orange line denotes the ratio of preliminary positive cases compared with the population being tested. For residents that are in breach of the RTD orders, they would be subject to a fine of $10,000. But so far, most residents subject to RTDs were cooperative, and they supported our testing work. And I have visited a number of sites, and I saw that our staff were working very hard, and our testing contractors have worked very hard as well. And that way the residents would know whether they have tested positive or negative. And at the end of the operation, those who tested negative can leave upon producing an SMS. Those who tested positive would be sent to community quarantine centers.
如果嗰位居民已經係喺第五波疫情，即係12月31號以後係確診咗嘅，
For residents who tested positive after December the 31st, they would no longer have to be tested. Since they had tested positive earlier, there was no need to test them again. And even if they tested positive again, they would be considered positive cases, and there is no need to isolate or treat them. Every day we conduct a large number of PCR tests of mandatory or voluntary basis. They are being conducted at community testing centers and mobile specimen stations. Given the prevalent use of PCR tests, while the number of tests conducted in the last 2 weeks have been in decline, but in the last 1 or 2 weeks, the daily number of tests remain at some 150 to 200,000. So the number of positive cases went down, and it peaked in early March. And we are entering a plateau, and that means we are not going to see an obvious decline. It shows there are still a lot of silent carriers in the community.
The following two charts are more academic in nature from the Hong Kong U team, released to the public on a regular basis. Now, people like to ask the immediate effective reproduction rate, and that is how many persons can one confirmed case pass on the virus. But then that hinges upon a lot of factors, whether there are social distancing measures, travel restriction, and whether masks are being worn. Now, according to the latest figure, it is now below 1, but still we have to remain vigilant. And the last is from the Hong Kong U again. They on a regular basis monitor the commuting or journeys made by members of the public. The more journeys made by members of the public, the higher the risk, and therefore that's why we have so many social distancing measures, including class suspension and work from home. Well, the figure dropped recently because of class suspension, and in this week there is slight sign of increase. I think the media have captured a lot of photos showing that people are now moving around in the community again, so we must not lower our guards. If people flow in the community increases again, then that may affect our state, given that we are in a stable but not on a declining trend yet. Now I'd like to talk about how we are going to strengthen support for the elderly. Last week we said that one of our focuses should be to reduce our death toll, reduce infections, and reduce serious cases. Now, we've got major progress. The first is the availability of drugs. Well, at the suggestion of the Hong Kong U team, medication is the most effective way. So on Monday, the second batch of effective oral agent, that is Pfizer's Paxlovid, arrived and is being used widely in Hong Kong. And Manuvaparava, manufactured by MSD, has already been used before Monday, and have made it very clear to the hospital authority that is most important to save lives, and therefore we don't have to be frugal in the use of the drugs, and we have contacted the most senior level of the two drug manufacturers, and so we can administer the drugs to lower the need for hospitalization. And as I said yesterday, the HA has already prescribed the drugs to over 34,000 at elderly care homes, outpatient clinics, and inpatient, and also A&E department, and also people who sought help at designated clinics, especially the elderly. I'm pleased to announce that according to doctors, the drugs are very effective. Starting from today, CGTN, and that is the Community Geriatric Evaluation Team, will support confirmed cases in elderly care homes. Based on clinical guidelines, doctors will administer such drugs if they consider appropriate. And also the Patient Support Call Center of Hospital Authority will also take the initiative to contact people being isolated at home with risks. If need be, they can be arranged to attend designated clinics to get the drugs. Now, we had Zoom meeting with the private hospitals last week, and they are very willing to provide beds, and they're willing to provide consultation for confirmed COVID cases at their outpatient department. We will provide these two types of drugs to private hospitals because they're not able to procure them themselves because the drugs are not yet registered, and so the drugs will have to come from HA's inventory. In elderly isolation centers and holding centers run by SWD, the medical staff will also administer the drugs to elderly patients. The fifth enhanced measure is to set up as many holding centers and community isolation facilities for our elderly as soon as possible. We already got 2 CIF and holding centers at 2 indoor games halls. The third at Harbour Road will will be commissioned today, and then by the 21st of March, we will also commission the CIF at Kaita Cruise Terminal, which offers 1,200 places, and 6 more indoor games halls will gradually be converted to serve as CIF. Another location is at Hung Shui Kiu. To further support the elderly that require isolation and to focus our treatment facilities, Hung Shui Kiu is a community isolation facility built with the support of the central government. It's actually a cabin hospital. We will have 200 places CIF come holding center for elderly persons that require isolation and treatment to lessen the burden on hospital authority. These elders are milder cases with milder symptoms, and they need isolation and medical support. As I said, when the hardware is available, the greatest bottleneck is personnel. So the government has adopted a multi-pronged approach to hire carers, including those from the mainland and from Hong Kong. 180 carers have arrived from the mainland, and after training, they will start to serve at holding centers. For local recruitment, judging from the number of applicants, we see that the response is very encouraging. But they need to be interviewed by SWD first to see how many will actually join the team. The fourth is to provide more support to RCHs in terms of provision of supplies and hotel facilities for closed-loop management of their staff. We understand that over 100 staff from over 100 elderly care homes are willing to adopt this closed-loop management arrangement. Starting from the 9th, they have moved into these hospitals. Another new measure is reverse isolation, and that is if there is an outbreak in care home, the appropriate approach is to move the non-infected elderly persons from away the RCHs. There are 2 licensed and newly built RCHs that can provide 200 places for residents, for healthy residents from RCHs with cases of outbreak. They can then be subject to reverse isolation to protect them from any infection. Of course, the most effective way is vaccination. Among the eligible group, that is those over we have already achieved 90% with the first dose, but those over 70 or 70 to 79, 80%, and those over 80, 55%, we have to raise the vaccination rate for these groups to 90% as soon as possible. The expert groups have agreed that the interval for the second and the third phase can be shortened. Apart from the elderly, children as a group, we want to boost the vaccination rate. For those between 3 and 11, 55% of them have been vaccinated. And if children want to resume classes after the Easter holidays, they must be vaccinated. For secondary students who have achieved to a 90 or over 90% vaccination rate, and if primary students cannot catch up, then that may affect the chance of resumption of face-to-face classes. I took a little bit longer time in my report, so I can reserve more time for questions. But I'll first give the floor to Dr. Edward Choi, Controller of CHP, to report on the RAT declaration work.
頭先我哋有張幻燈片特別講到係話個 RAT 平台，我哋喺3月7號嘅
From one of the slides, we talked about